Hey everybody, it's Lisa from Lisa Bug Fitness and Yoga, straight talk on knee replacement. Today our topic is the difference between active and passive range of motion. And your physical therapist is likely going to have you work on both styles of extension and flexion, both the active and the passive, and they are going to probably want to measure both of those numbers when you are in physical therapy. So active range of motion is that range of motion you can achieve by firing your own muscles and no external help. So active flexion would be the amount that you can bend your knee by using your hamstring muscles on your own. Active flexion would be the amount you can bend your knee by using an external force such as a yoga strap, pulling with your arm, the physical therapist pushing your flexion. And the same thing for extension. The amount that you can straighten your knee actively is the amount you can straighten by contracting your quadricep versus passively by using external force. So I'm going to give you examples of both so you know how to work both active and passive range of motion when you are at home doing your physical therapy exercises for recovery. So I'm going to use a yoga ball today to show you what active versus passive extension is, and that's the amount that you can straighten your leg. So if I'm doing active extension, I want to see how much I can straighten my leg by firing this quadricep. And right now I am about 3.5 months post-op, and so I'm still working on my active extension and I'm not quite to zero actively. So I'm going to just take this leg and start to straighten it out, and I'm extending this leg as straight as I can. Now I'm pretty close to zero, but I do still have a little bit of a bend in that knee. I'm tightening this quadricep and then I'll relax it. Active extension, I take it out and I try to straighten that leg as hard as I can. Now if I add some external force, I can get a little bit more range of motion, a few more degrees. And so I can take my foot up on something, and then as I'm extending it out, I can either press down a little bit with my hand, or I can let gravity help to pull this down. And I don't know if you can quite tell, but I definitely have more range of motion when I'm passively extending rather than when I'm actively extending. So that's extension. Now flexion, there's quite a few different ways that we can work on active versus passive. So active, again, that range of motion that we have when we use our muscle. I'm just going to let that roll away. Okay, so if I sit in a chair or stand up and then take this leg, the surgical leg, and try to bend my knee on my own, you'll kind of see what my degree of flexion is. That's my active range of motion because I'm firing the hamstring to do that. Now I can get my leg back a little further if I add external force or a passive stretch. So I'm going to take that leg, bend it back, and then press with my other foot, and you can see how much more flexion I have when I use external force. Now we can combine active and passive and do them at the same time. So I can take this leg, pull it back, fire this hamstring, keep firing it, and then add that external force. So I'm doing both at the same time, and that's a nice technique as well. One more way I'll show you today is the dreaded heel slide. So if you can come down onto the floor during your recovery, and for this one, you can just simply take a washcloth on a slippery surface, or there's other pieces of equipment out there like heel slides. And then I'm going to take this leg, extend it straight, and then I'm going to pull it back and bend it as hard as I can using that hamstring. You can do this laying down on your back. You can do it in bed. A nice way to do it in bed is to take a cookie sheet and then wear a sock, and you can slide your foot along the cookie sheet. So that's what active flexion. Then I can add an external force by using my yoga strap, placing that around the foot, and this is probably what the physical therapist will have you do. I'm going to bend the knee, and then using that yoga strap, I'm going to pull back even further. That is my passive range of motion. So I hope this helped you today. Be sure that you subscribe to my channel so that more knee warriors can get this very important information. If you have any questions, you can give me a little comment or let me know how these are doing for you. I love to hear from you, and I'll see you next time. Stay strong, knee warriors, and take care.